Good morning, everyone. Good morning. Today is the 50th anniversary of Earth Day, so happy Earth Day to all those who are on the call and all those who aren't on the call today. I'm Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and I'm pleased to welcome so many of you back to our weekly Chamber COVID-19 Teletown Hall. These calls continue to be a source of timely and unfiltered information directly from the leaders on the front lines of the COVID-19 challenge. From the very beginning, our mantra has been facts over fear. As things change rapidly, especially as we move toward the reopening of our beaches and our businesses, the Chamber is bringing together business leaders, our elected officials, residents, and healthcare professionals to launch the Path Forward Readiness Plan. It's a comprehensive strategy that will provide protocols for the best practices and protective measures to ensure the health and safety of our residents, our workforce, and our visitors. The plan will serve as a roadmap to incrementally reopen business in the Lowcountry and has the potential to serve as a model for other communities in the state and across the nation. This ambitious goal of the Path Forward team is to have the plan completed between the end of April and the first week of May. While it's easy to focus on the negative aspects of this challenge, there are many positive initiatives happening in our community. And I'm pleased to report our Help for Hope partnership with the Watterson Family Foundation will have handed out community investment cards for over 10,000 meals by the end of this week. That reflects a $125,000 economic impact for local restaurants. The program is providing for those in need, helping businesses, and keeping jobs. Later in the call, we'll hear from J.R. Richardson and Lee Lucier and the great things that they are doing with Operation Barbeque Relief. We received great news last week that the PGA Tour will resume play and the RBC Heritage will be the second stop along the way from June 18th through the 21st. While there will not be a gallery and all the activities we associate with our beloved tournament, there will be millions of viewers around the globe watching the world's best golfers compete on Harbortown golf links. We'll hear more about that in just a little bit. Businesses are starting the road back to recovery and reopening. And here to talk more about that, along with his thoughts on the RBC Heritage, is our first speaker this morning. We're pleased to welcome the governor of the great state of South Carolina, Governor Henry McMaster. Governor McMaster, welcome to our call, and we're delighted to have you.
Thank you, Bill. I'm glad to be here. Frankly, I wish I were there. I haven't been to the beach in so long. We've been fairly secluded out at the Emergency Management Division and here at the mansion. But I was listening. I'm glad to hear the progress, and I want to just assure everybody that we appreciate the hard work that's going in the foresight, the innovation that our people are experiencing and showing for the rest of the country. I think we're doing this thing just right. We, as you know, and I'll be brief and maybe have time for a couple of questions if you like. If that's what you want to do, Bill.
Sure. Thank you.
We went in, as you know, very deliberately and cautiously and carefully based on the facts and the data and the science that we're receiving, as well as the facts and complications and repercussions on the ground. Our goal was to do as much damage to the virus as we could and do the least damage possible to our economy and our people. And I think that the way we did it was a good one. In some other states, they tried to determine which businesses and activities were essential and which were not, and ended up with huge lists of both that were almost indecipherable. We did it a different way. We determined, looking at the facts and the science, as to which types of activities involved in which businesses that would be considered ordinarily would be on such a long non-essential list. But we looked to figure which ones offered the most opportunity for physical contact, closeness, and congregation that would be the places where the virus would take hold the quickest, the easiest, and go the farthest. And that's why we did what we did, starting with the restaurants and then going into the different businesses like the barbershops and beauty parlors, and then at that same time the theaters and spectator sports where you have big crowds, concerts, those sorts of things. And then finally, just over 2 weeks ago, we extended that into the small retail arena. Now, the big boxes asked for some help and suggested that a 20% rule would be a good one for them. That is, for every 1,000 square feet, you could have 5 customers, or you could have 20% of your regular capacity with all social distancing. So we use that. They wanted that, and that's what we did. And in the smaller ones, we had them restricted just to delivery and service out the front door. But on Monday, we removed those restrictions on those smaller businesses. And again, we're reluctant to impose restrictions at all, but it's just something we had to do according to the science. But we removed those restrictions and went to the 20% rule on furniture and home furnishing stores, clothing, shoes, jewelry, luggage, department stores, flea markets, florists, and those sorts of things. And so now they're operating under the 20% rule, and we hope to be able to lift that. We're making plans and studying the data and the experience for the other things that have limitations. But we think we're going in cautiously and coming out carefully and cautiously, but steady. This is a place where we use the carpenter's rule, measure twice and cut once. It's also where slow and steady wins the race. And we want to win that race. And as you know, we turned over the authority back over to the mayors and councils along the beaches to make the decisions that they wanted to make as concerns their beaches, because we had closed the access, as you know, after we had a lot of non-compliance. But we have released that state rule, so that's back with the localities, and some said they would open, some said they would not, and that's their decision, and we respect that. I'm delighted about the PGA Tour, the Heritage. I spoke to those organizers a few days ago, and encouraged that. And is Mary, I think it's DePalais, and with the RBC Heritage, and they are great people, and we're happy to have that. We're also working to see that we want to have the Darlington Raceway opened up before long as well, which will give us the first NASCAR event, we think, in the country. But we are, and with the PGA, with the Heritage, that of course will be with no spectators, June the 18th through the 21st. And I want to thank Bill Goodwin and Sea Pines for all that they're doing to make all of that possible, because it wouldn't be possible without their help and assistance. Also mention all to Bill is Jeff Bradley. You got your local, your elected leaders there have been very helpful during this. Jeff Bradley and Shannon Erickson and Tom Davis have been giving advice and guidance along the way, and they've been very helpful in others as well. But we are trying to revitalize our economy. It's been the reins have been pulled pretty tight for a while now, and we want to revitalize it as much as it can in order to get things moving again. And we are confident that if we keep doing what we've been doing, now that we all know about social distancing, now that we understand the virus better, we think that we can remove these restrictions slowly but steadily and get back to full capacity very soon. So that's the way we're seeing it from here, from now. And I'll be glad to answer some questions if you have some.
All right, Governor, thank you. And thank you for that update. We also greatly appreciate your support for the RBC Heritage, as that's so important, not only to Hilton Head Island, the region, but also the entire state of South Carolina. The first question, The first question this morning, Governor, comes from Steve. He's a restaurant owner here on Hilton Head Island and was wondering if you could share some insight on the indoor seating and reopening of restaurants.
I'm glad you asked that question. We're working on that now. We've been working on it to get the details, to get the facts. It's a lot easier to make good decisions once you have all the facts, but sometimes it's hard to get the facts. But we are assimilating those, the insights and facts. We have some restaurateurs on our Accelerate SC group that will be meeting tomorrow in Columbia at the University of South Carolina Alumni Center. We have 30 representatives plus some 6 from the House and the Senate, but 30 representatives from business and industry, agriculture and tourism and service industries across the state to provide ideas and insight. And many of them have already been doing that, and that's how we got to where we are now. But we've made an official group that will get together, assembled at some points and unassembled at others, and finish their work within 30 days to give advice on what the best thing to do is. Duane Parrish, who by the way is doing a fantastic job. I've told Duane that we rely on him heavily for his guidance and insight in these things. But specifically for restaurants and also for the beauty parlors and barbershops and all those things, we have been working around the clock to understand exactly what we can do and what we should not do. And I hope to be making an announcement about that soon, but or at least give some idea of when we'll be able to make some recommendations at that time. By the way, we made a lot of recommendations. We've had some orders, but we've made a lot of recommendations, like for the hospitals to reduce their elective surgeries as much as they could to allow for the surge. Well, the hospitals, the nurses, the doctors, all of them did a fantastic job. And we have now learned that we can get ready for that surge very, very quickly. So they have been resuming those surgeries to try to keep the hospitals vibrant. But we'll have some news again to answer your question. I hope it'll be in just a few days. I can't ever promise anything because we don't know what might happen. But Duane, I'm confident Duane will address the restaurants and many of the things dealing with tourism.
All right, Governor, thank you. And we certainly here in the Lowcountry share the mutual admiration for Duane and his leadership that he continues to provide their SCPRT and really for the entire tourism industry of the state. One more question for you, because I know you got to run. Same question from 2 people, one from Deborah, one from Margot. And we also have our great superintendent, Dr. Frank Rodriguez, is on the line, and he'll be addressing the group later. But this question that is asked for you as well as for Dr. Rodriguez is about schools. And any thoughts on the reopening of schools, or when the date will be determined that schools will continue to operate online?
Well, a good question. We're going to have a press conference on that today. We've been working with, of course, Superintendent Molly Spearman, and she's been working with people all over the state to get information. We'll be making the final decisions and having a press conference on that today in just a few hours, I think.
Governor, we'll be dialing in and watching for that. Thank you for your time this morning. We appreciate what you're doing and your leadership for the state.
Bill, let me mention this. The school situation, Superintendent Spearman and all the district representatives, everyone involved have done a fantastic job. And we got about 500,000 K-12 school children, and a lot of them need to be fed. The main food that they get is when they come to school, and without even a hiccup, we were able, through that grand network, the education network, with the teachers, the administrators, the kitchen personnel, and Superintendent Spearman and others, and all the superintendents around the state, were able to transition into being sure that we could feed those children that needed so. I mean, by millions of meals, it's over 1 million meals have been served. They had them going out in school buses and everything else. And of course, enormous work in seeing that the distance learning was taking place, and the universities and colleges have done that as well. It has really been a heartening thing to see all the people with so much talent and so much insight. They're willing to put the shoulder to the wheel to be sure that this virus doesn't knock us down. I'm reminded of the great champion Muhammad Ali, when the boxing champion, the young fella, said to him one time, he said, "Champ, didn't you get knocked down one time by Mr. Furman or Joe Frazier or somebody?" He says, "Son, I never been down. I'm either up or getting up." So that's the attitude that I really do appreciate. The people of South Carolina are so strong, and it's really an honor to work with them.
Governor, thank you. Thank you for being with us this morning, and we appreciate all you're doing.
Thank you, sir. Appreciate it, Bill.
Sir, we're going to move on to our next speaker this morning and piggyback a little bit on the RBC heritage. And we're delighted to have with us Steve Wilmot. Steve thought he would have been pleased to be able to stage one tournament this year. And now he has the opportunity to stage two tournaments. So Steve, welcome to the call.
No, Bill, thank you. And if there's one thing I've learned is never say never. But I wish the governor was still on the line right now, because when the question was presented to him about 2 weeks ago, it was within a half a second, he goes, "Let's do it." So, but he was spot on by thanking so many. And the young lady that he mentioned, Mary DePauli, is the RBC representative. She's executive vice president and the chief marketing officer for RBC. And they were very much engaged in this whole process. But I thank the governor and the state of South Carolina for all their support and guidance on the front end. When we unfortunately canceled the event, but it was the correct thing at the right time. But also here most recently, and wanting to open things up and get going again. But also a big thanks to Duane Parrish, who we'll hear from later too. His assistance and guidance through this whole process has been incredible, along with both of our mayors, our town managers too. I mean, it was a true team effort to get to this point to open back up and give us a second run at this event. And Bill, and your leadership, Jeremy Clark at your team too, just what you've been through and your guidance and assistance as well has been tremendous. And then a real shout out too goes to, as the governor mentioned too, is to the Sea Pines Resort and the Riverstone Group as well. I mean, it's one thing to say, yes, we'll do it. It's another is, can we do it? And there was a lot of moving parts, and it still continues to be a lot of moving parts, and it's a big puzzle, but it's again an incredible effort by so many. And I thank all those individuals. And the safety and well-being still is of utmost the most important thing to us, to this community, and working with everybody. And it's real easy to pull the plug overnight on something, but you certainly can't plan overnight. So we're fully engaged with all this community. And when I say this community too, I thank this community, everybody on this line, and those that are not, from our volunteers to all the support, because it's because of you, it's because of us as a team that the tour gave us this opportunity. There's a lot of other communities and a lot of things going on, and it's a work in progress. It's very fluid. We're going to make sure we do the right thing, but you just can't plan overnight. And we're full steam ahead. But this opportunity was presented to us, and it was, yes is the answer. What's the question? And we have a lot of questions still moving forward, but to be on the schedule, to be able to showcase this incredible community, this incredible state, it truly will be a win-win-win for so many. But and I thank the volunteers. You have no idea the support we've gotten from our volunteers too, and the fact this community is special. It is volunteer and giving, and now it's a matter of where do I sign up? How can I assist? How can I help? And it will be a different feel. We certainly know that without spectators, but it is the right thing at this time. But given this opportunity, it's tremendous for all of us, and it will be a win-win-win for all, and get us back on track, the foundation. And our mission is to give back, as it is with the PGA Tour. it's something that we want to make sure we get back in track so we can give back to this community and the economic impact and all. But it's been a difficult time for all. And the well-being of all is the most important thing. And if this is an opportunity to shed a little light and get us started and put us back on the map with some things, we're fortunate to be a part of it. And I thank each and every one of you. I'm honored and blessed to be a part of something so special, and it's certainly this community. So we got this, and we look forward to the next 6 weeks, and but looking forward to celebrating something even more special in next year as well. So Bill, I'm more than happy if I can talk. I got a lot of things to talk about, but I certainly don't want to take up too much time.
Steve, thank you for all the feedback there. We do have a question for you from Susanna, and she's asking if the tournament needs volunteers for the event. If so, if you know what positions you're looking for at this point.
Well, it's a very fluid operation. There's a few areas that we're going to be working with, but you can contact our office, and we have an incredible group. We've already, certain areas, our marshals or the walking scorers or shot link and some of those things, all the scoreboards will be out there for reasons. So there's still some operational needs, but please reach out to our office here, and Cindy Bruton is our volunteer coordinator. I'll be more than happy to try to fit you in there.
Steve, thank you. We know you need to run, and we appreciate you being on the call this morning.
No, thank you, Bill, and thanks for coordinating this. And again, thank you for the chamber support too. We're all in this together, and we got this, and look forward to seeing everybody in June.
Great, thank you. We'll probably have a few more updates from you between now and June.
Absolutely, thank you.
All right, Steve, thank you. Continuing with our thoughts regarding heritage and tourism. We're fortunate to have Duane Parrish back, and Duane, as you know, is the head of South Carolina Parks, Recreation, and Tourism. Duane, welcome.
Thank you, Bill. It's a pleasure to be here. Just sort of following up from the governor, I want to thank many people and Steve Wilmot as well. Many people for pulling off. I mean, it's a large job pulling off a golf tournament in normal circumstances. It's probably even harder in times like this. So kudos and thanks again to the Goodwin family, the Sea Pines, to the Heritage Foundation, to your organization, Bill, the Chamber of Commerce, as well as everybody on the island to be able to make that happen in the short time period, as well as do it with no spectators. But I can tell you, showcasing Hilton Head on CBS television and the Golf Channel at the beginning of May or middle of June, is just tremendous. I couldn't spend that much in advertising to get the benefit from that. So thank you and kudos to everyone who made that happen. Just a quick update of sort of where we are today, and then sort of what lies ahead, at least in the immediate future. Everything is sort of written in pencil these days, but there are 545 hotels closed statewide. Most of those, roughly half, are in Myrtle Beach due to a local ordinance, but they are slowly starting to reopen now in Myrtle Beach. That's about just over 40% of our total hotels. I want to emphasize this does not include short-term rentals, but these are our standard hotels throughout the state. That number, as I mentioned, is stabilized recently. We've had a few open, a few closed, but it's sort of leveled off, if you will. Statewide occupancy remains in the 20% range. That seems to have leveled off as well recently. Certainly there's less supplies, I just mentioned, but also it varies by location. Interstate properties seem to be faring better than those in metropolitan areas. And also they seem to be faring better during the week and weekends, which tells me there's still some commercial or business traffic out on the roads, or people that are staying overnight. But that certainly seems to have leveled off. And I think some of those hotels that are closed right now, even if they thought they could open tomorrow, wouldn't. They will wait for market conditions to improve to open up. Because if they closed at 20% occupancy, they don't want to reopen when occupancy is 20%. So a little patience along the way, as some of those will slowly reopen across the state, and we'll get that back. As most of you know, boat landings have reopened. That has gone very well. As the governor mentioned, I think people are much more aware of social distancing today than they were at the end of March. That seems to be the place, how to do it, why to do it, and also why it's important. Beaches, you heard the governor talk about, he sort of allowed the local authorities along the coast to make that decision. As I speak to you today, Surfside Beach and North Myrtle Beach are both open to the public. Isle of Palms has some limited access to the public, but along the way, I think as time goes by and these local governments feel more safe to open, they will do so as we go along or down this path, if you will. One of the questions the governor got from a restaurateur, when will restaurants be allowed to reopen their dining rooms? So the South Carolina Restaurant Lodging Association is working in conjunction with DHEC to present a plan to the, you heard the governor mention the Accelerate SC committee or task force, if you will, to present a plan to that task force that would show what the new dining room looks like. Obviously, there'll be some differences, and don't know what those are yet, but we wanted to have DHEC along the way, have it come from the industry, and then sort of present it to the governor and say, okay, here's what the industry would like to do, and it has DHEC's blessing from a health and safety standpoint to sort of move forward. In terms of a date, I don't know, but a plan that we should have that plan in the governor's hands by the end of this week in regard to having a plan to go on when that time comes. Also, state parks, it may or may not have been released a statement last night. State parks will tentatively plan to reopen on May 1st. Obviously, as I mentioned earlier, everything's somewhat fluid. That date could change. But as of right now, 47 parks will open up to day use on May 1st. We will open up to take reservations on May 11th. Gives us a chance to sort of manage things from a day use standpoint. When I look back at why did we close, several things happened. One, we're overwhelmed with crowds. Number two, people were not social distancing like they should be. As I mentioned earlier, I think they're much more aware of that now, puts us in a better position. And also the South Carolina Parks and Recreation Association, which is the organization of local parks, that is counties and municipalities, is going to recommend reopening to counties and municipalities around that same time, which would take some of the or the push, if you will, or the population. Quite a few going to parks should help relieve some of that. I know everyone has a lot of cabin fever right now and is ready to get out. We, from the state's perspective, we certainly want to help that. Also, we will working on a recovery plan. Bill mentioned earlier in his about getting the local economy there going, but from a state perspective and tourism, we have a plan in place now. Just sort of the top line things for you is there's not a call to action right now. It's more inspiration. It's called Dream Now, Discover Later. That is going on now and will ramp up even more so May 1st. Just to keep South Carolina in top of mind of those travelers and those people. We know there's people are spending more time online now, more time streaming with television and so forth, to sort of keep South Carolina at the forefront of that. When the call to action time comes, and I'm not certain when that date is, we have a second phase of that. We'll essentially ask people to come visit. But I'm confident we'll pull that off in a way we've done all along. This is not new to us. We have infrastructure in place to make this happen. It's just sort of on steroids at this point in regard to getting business back. But we'll concentrate on those drive markets. Obviously, I'm not sure people will start flying right away, but we'll concentrate on the states that drive in. That's roughly a 350-mile radius. We'll probably extend out to Ohio because of Interstate 77 and its direct route into Columbia. But certainly we'll go into those markets, but we'll only go into the ones that don't have a stay-at-home order in place by that time. We'll monitor those and only go into states where it's appropriate and people are told it's okay to travel. Bill, pending any questions, that concludes my report. I would just urge everyone to stay safe. And the good news is I think I see light at the end of the tunnel now. Thank you, Bill.
Thank you, Duane. And as just for our listeners, our tourism recovery plan, we're looking at rolling that out roughly along the same time frame of what the state is doing. And it'll be when the town of Hilton Head Island and the state feels that time is appropriate. Duane, you mentioned one thing about people wanting to get out, and we did a survey, I think 2 days ago, just asking if our residents, businesses were in favor of reopening the beach access with proper social distancing guidelines in place. And that came back with 663 pretty quick respondents, 61% saying yes, they would like to see that happen, and 39% saying no. So people are anxious to get out. They want to do it in the right way, the right manner, at the right time. So thank you, Duane, and we appreciate your support. we'll be in touch with you, I'm sure, probably either this afternoon or tomorrow.
Thank you, Bill. Look forward to it. Stay safe,
Okay.
everyone.
Thank you, Duane. We'll move on to healthcare now, and we're happy to have with us Dr. Michael Kacka with DHEC. Dr. Kacka.
Hello. Thank you very much. I appreciate the opportunity to speak again. So as of yesterday, DHEC is reporting 172 new cases of COVID-19, which brings the total number of people who have tested positive for the disease in South Carolina to 4,608. This includes 32 in Beaufort County in the past week, making the total there 233. Sadly, there have been 135 deaths reported in the state, and this includes 9 in Beaufort County. Many nursing homes in the state are struggling with a large number of cases. These environments are prone to the spread of COVID-19, and those residents can experience more severe disease. Both regional and central office DHEC staff have been working closely with these facilities to discuss appropriate infection control methods. Additionally, consultations have been done with the CDC to ensure all appropriate measures are being taken. While we've been working to enhance our outreach efforts, we need to do more. We are exploring new ways to reach high-risk groups, including working to form partnerships to help express how conditions such as diabetes, hypertension, asthma, and obesity exacerbate COVID-19 symptoms. We realize we're asking a lot of the citizens, and it's not easy. But what we're calling on South Carolinians to do by staying home and limit contacts is crucial to controlling the spread of the virus and ultimately to saving lives. As South Carolina potentially flattens its curve for new cases of COVID-19, it will remain critical for everyone to continue to practice social distancing and limit close contact with others to prevent the spread of the virus from increasing again. Successful reopening of the state is dependent on everyone continuing to do their part by following the recommendations from public health officials. If you can't stay home because of work, please consider protecting yourself by wearing a mask. This is especially important for those with chronic health conditions. And for the latest information, please do visit our website, scdhec.gov/COVID-19. And I'm happy to take any questions at this time.
Okay, thank you, Doctor. The first one comes from Casey, and Casey asks, what can we do to get more tests allocated to us so we can test more people on Hilton Head Island and in Bluffton?
So that's something that we're working with. There's been a whole lot of barriers to this. Our public health lab has capacity to run more tests, but there's been other shortages, such as the testing supplies that are needed to collect the tests and the protective equipment that's needed for the person who's collecting the specimen. So it's not just the availability of the tests themselves, it's some of the equipment and some of the processes that need to be fixed. So these are things that we're looking at because we are aware that we need to be able to increase testing to really successfully do a reopening of the state.
Okay, the next question is from Deborah, and Deborah is asking if the private labs are still running a few days on reporting their numbers, or if those numbers are up to date each day.
We believe they're fairly up to date. The problem is we have new labs running tests all the time, and sometimes we have to correct them on their process. We will have a delay in them reporting their results. So we do have to reach out to them and let them know that they do need to report results every day to us to make sure that we have the most up-to-date information. But the labs that we've been working with have been pretty good about reporting their results on time.
Okay, Dr. Kacka, that does it for today. Thank you for being on our call. We're going to move to Jeremy Clark now, the Market Chief Executive with Hilton Head Hospital. Jeremy.
Good morning, Bill. How are you?
Very well, thanks. Welcome.
Great. Thanks for having me again this morning. As in previous weeks, Hilton Head Regional Healthcare continues to operate safely and effectively. And the message that I want everyone to hear today is that we are ready. You know, Hilton Head Hospital and Coastal Carolina Hospital have spent the past month changing our processes, preparing for a surge of patients that was originally forecast to come later this month. We've implemented visitor restrictions. We're screening everyone who enters the hospital. We've created a labor pool of staff and physicians, and we've cross-trained them to meet future needs. We've reduced our census. We've postponed elective procedures where we could. And we've increased our ability to provide ventilator assistance to patients. We've rehearsed plans and formalized plans to add critical care beds and lower level med-surg beds. And we've offered our support to provide care outside the walls of the hospital if that's needed. From a personal protective equipment, a PPE perspective, today we have used it safely and conservatively. We've continued to receive shipments of PPE from both existing vendors, but also new vendors that we found as well. And we've improved our ability to get test results, and really appreciate DHEC and their work for getting those 24-hour turnaround on the test results. So, and we've received great support from the community, as I referenced last week on the call. Great support from the community. We've had good leadership from the governor and our state and local officials who've provided very sound guidance, and our community very wisely has heeded that guidance. So, in short, all of these actions have worked thus far. We have not seen a surge of patients that was originally forecast. Today, our hospitals have more than an adequate supply of PPE. And we have no staff that are quarantined. So we have a full supplies, full availability of both staff and beds at our disposal. But we're not letting our guard down. We're not celebrating victory. We're staying vigilant. Again, we are ready for whatever comes this way. We also know that patients have needs and care needs outside of COVID-19. And our 3 emergency departments across the community remain operational 24/7, staffed with board-certified physicians. Our ER staff have an ample access to personal protective equipment to keep both our patients safe and to keep themselves safe. The local EMS providers do a great job. They're very well trained on delivering safe care and preventing the spread of COVID-19. So if people in our community are having a medical emergency, they need to feel safe in calling 911, and they need to feel safe going to the ER. And we're ready. We're here ready for them. Additionally, this week, we started safely resuming elective surgeries. We know that patients have been postponing care that they need, and we have the surgeons and the staff that are available to provide this care safely. So in addition to everything else we've been doing lately, we've added additional safeguards that include keeping our potential coronavirus patients away from surgical patients as well, just to add another measure of safety. So we're ready to provide this care as well. Finally, and the governor referenced this earlier, we know that if in fact we do see a surge of patients, we can ramp down these services, and we can implement the plans that we have formalized and that we've rehearsed so that we can take care of that surge of patients. So in summary, I want the community to know that their local health system is ready for them. We're ready for whatever comes this way. So, Bill, I appreciate your leadership on this call and the leadership that we've received from state and local officials. I appreciate all of the support that we've gotten for our caregivers here. And I'll turn it back over to you and see if there are any questions.
Jeremy, thank you. And we had several questions, but you have answered those questions. They were primarily around the ER and then elective surgery. So thank you for addressing that. Also want to congratulate you and your team for all the fine things that you're continuing to do, and making us all certainly feel very, very confident of our hospital. And then lastly, I enjoy hearing your preparedness over panic periodically, and we're certainly glad that you're leading the charge on being prepared. So thank you, Jeremy.
Thank you, Bill. We appreciate the support.
Next, we'll have Melanie Matney, and Melanie is with the South Carolina Hospital Association.
Hi, well,
Welcome.
Thank you so much for having me. Can you hear me all right?
Yes, welcome to the call.
Thank you. I have 4 things to mention this morning. First, about surge planning. So SCHA, the South Carolina Hospital Association, is so proud of our state's hospitals. It seemed like a drop of a hat, as Jeremy mentioned. The hospitals created significant bed space for a dreaded rush of COVID patients, and they demonstrated how quickly they can maneuver when needed. The hospital's commitment to communities is inspiring, and it keeps us moving every day. SCHA has been thrilled to be part of the statewide surge planning work. We have learned a whole lot over the last 6 weeks about alternate care site locations, processes, procedures, and how the state agencies work with hospitals. And I can enthusiastically say that we're ready should we need to create additional bed space. Even this week, we continue to talk about needs, especially for Tier 1 alternate sites. A Tier 1 alternate site provides shelter for those who don't really have the ability to self-isolate or who don't want to expose their family members. And we'll continue to talk through this. Second, I have a comment about reopening. we need to continue to be very measured and responsible on our reopening, not only for hospitals, but for communities as well. Several hospitals across the state are in need of PPE, and we all need more testing supplies before we'll be in really good shape. As Dr. Kacka just mentioned, there were 172 new cases reported as of yesterday. That's more than what was reported in prior days. There were 169 cases the day before and 62 cases on the 20th. So that's not the right direction. We know that people in our economy are ready to get out to work, ready to get out of the house, ready to go shopping, go out to eat, anything that's not in the house, but we have to be careful. We have to remember that the disease is still here and it won't go away until we have a vaccine or at least a very good treatment. So SCHA is encouraging hospitals to maintain their tight visitor restrictions and to phase their reopening because we know that people are going to continue to get COVID. And we have to know that the number of available beds, though it was increased, it will decrease as we continue to reopen. But hospitals will get in really big trouble when everyone gets sick at the same time. So we have to protect them. We have to be careful about our reopening. Christian Sora from the SCHA staff will be participating on the Accelerate SC Task Force, as mentioned a couple of times on today's call. Third, I want to mention about hurricane season. So very unfortunately, hurricane season starts in just 5.5 weeks. And even though COVID will still be here, the last thing we need to be doing is evacuating and transporting COVID positive patients throughout the state. So SCHA is encouraging all hospitals to keep up with their fantastic hurricane planning so that if the need arises, we can make the absolute best decisions for patients and for those patients across the state. And finally, I just have one quick note about nursing homes. So yesterday afternoon, DHEC announced that they will begin publicly providing a twice-weekly update on the names of nursing homes, assisted living facilities, and other similar facilities in the state that have an associated confirmed case of COVID-19, as well as the number of positive cases for either residents or staff members. And later in the week, DHEC will begin to provide the number of deaths associated with these facilities. I say this because SCHA is encouraging hospitals and communities to reach out to their nursing homes and offer assistance, such as training and how to take on and take off PPE, other training, staff, and potentially PPE if you have it. So thank you all so much for having me today. I'm happy to take any questions.
Melanie, thank you for dialing in, and we appreciate your report and your update. We're going to switch now to education and Dr. Frank Rodriguez. Dr. Rodriguez, Superintendent of Beaufort County Schools.
Good morning, everyone. Thank you for having me on the call. I wasn't able to get on early, so I wasn't. I'm not sure what the governor had to say today on the call. Although I do know that there's a conference call at about 10:30 with the state superintendent, and then I believe he has a press conference at 11. So I'm not sure if we'll get some information at that juncture if he shared anything today. I can tell you we're continuing with our work and continuing with meal distributions. We're about 189,000 right now. We expect that by the end of the day, we'll be nudging right up to 200,000 meals. Additional information, Hargray that has been providing access to families for 60 days, has added a line in Spanish so they can connect some of our Spanish-speaking families that are having trouble engaging them. So they took that step to connect with them and provide more access for others. That's essentially where we are today.
Thank you, Dr. Rodriguez. And the governor alluded to the press conference coming up, but did not give us any early indication of what the announcement would be.
Okay.
So thanks for joining us.
Thank you.
Good luck at 11th.
Thank you.
All right. Let's transition now to Fred Green. Fred's the president and CEO of the South Carolina Bankers Association. Fred?
Bill, good morning. I hope you can hear me.
Yes, sir.
Okay, great. Bill, thank you again for including me on your call. They're informative to me as well. I'm going to jump right into the PPP program and kind of walk us through what happened last week and then what we see this upcoming week. So I think everybody's familiar that the PPP dollars ran out Thursday around 10:30 a.m. And just to clarify that process and the way it works, banks would receive the application, ask for and review the supporting documentation. Once the package was complete, they would then input that information through an SBA portal. When SBA approved the PPP loan, then that amount they approved factored into the buildup of the allocation until it was depleted. So when I said it ran out about 10:30 a.m. Thursday, the reason I know that is because a lot of our banks who were feverishly trying to get in as many applications as possible through that SBA portal, suddenly around that time got notification that SBA was no longer accepting applications. So after around 10:30 on Thursday, SBA stopped receiving applications across the board. From the 10-day period when the program started, and there was a very steep learning curve, everybody had to come up to include banks and SBA. South Carolina banks had approved through that system $3.8 billion in applications that would be dedicated to helping around 23,000 small businesses in South Carolina. The average, if you just work the math, is around 165,000. I know there's been some high-profile public companies that maxed out at a $10 million type loan, but at an average of 165,000 in South Carolina, if you work the math, and this is all based on payroll for a 2-week period, plus some other things, it would indicate that that the average small business in South Carolina, as measured by number of employees, would be less than 20. So again, I don't think we had any of the high profile one-off kind of stories floating around on TV. So what we did on Friday is we polled all of the South Carolina headquartered banks and asked to get a number of the applications that they had received, the dollar amount of those applications, and the ones that had been received but not approved by SBA at the point that it shut down. To avoid double counting, my peers from the other 49 states did the same thing and asked the same information just for banks headquartered there. And the purpose of all of that was to aggregate the vast amount of applications and dollars that were pending across the country to small business owners, so that we could then share that information with Congress to ask them to act very rapidly on passing an additional funding. So what's next? I think everybody's probably aware that the Senate passed a bill yesterday setting aside $320 billion. And it's kind of broken out in a number of different ways, but without going into all the detail of that $320 billion, $310 billion is similar to the original PPP program. There's some allocations for different size lenders, but that passed the Senate yesterday. It goes to the House. The House will debate it tomorrow, assuming that the House passes it with no strings attached, no changes, no amendments. Then it would go to the president for signing. Once the president signs, It then goes to the Office of Management and Budget. They review the application, they review the process, and they set aside the dollars that then go to SBA. And then at that point in time, SBA has the allocation and they can begin receiving applications. And I don't know when that will be. I think the earliest would be Friday. Maybe the latest would be Monday. The banks in South Carolina that received applications from their small business clients that did not get processed and approved by SBA, they are holding those applications. Some are even taking additional applications. And once the SBA allows applications to be processed again, those banks will be working 24/7, once again, processing those applications to help their small business clients. The dollars on this second round, although a little smaller in amount, is expected that they will be allocated much quicker than the 10-day period of time for the original 350. That's a result of the completed applications sitting in banks throughout the country, as well as having come up that learning curve very rapidly and now able to process applications more rapidly. Bill, I don't know if you have anyone from SBA on the program later.
We do. We have William Furman who will follow you, Fred.
Okay. Well, good. William could maybe add a little more to what I said, and I'm sure he'll talk about the EIDL program as well. But with William coming after me, I'll just stop now, Bill, and see if there are any questions.
Okay, Fred, let's I have several questions here, and we'll ask William to jump in and with his report, and then we'll ask both of you the questions. So William Furman with SBA. William, welcome.
Good morning. Thank you. It's great to be here. I appreciate you having me on the call again this week. Fred he covered the PPP program pretty well, but I do want to touch on the EIDL and maybe a couple of other things. But as he mentioned, SBA did stop accepting applications for the PPP last Thursday. And in addition to that, SBA closed the portal for our economic injury disaster loans, or EIDL loans, as we call them. And that was due to the limited availability of funding as well. So just, to put some of this in perspective, and just maybe, Fred talked about some state numbers, but just overall, I just think this is pretty amazing. SBA provided more than 14 years worth of loans in just 14 days. And I say SBA, and it's not really SBA, it's lenders as well. And so you have SBA lenders that have just done a tremendous volume. They've stepped up to the plate, and we've all pulled together very well to get this done. On a national level, that was like 1.6 million small businesses. 5,000 lenders participated in the PPP, including community banks and credit unions. SBA has picked up many new SBA approved lenders, and our hope is that once we get past this, that we will retain those banks and that they'll continue to participate with SBA. But going back to EIDL, the SBA Office of Disaster Assistance is continuing to process applications on hand for those economic injury disaster loans. There was just an overwhelming response when this first came out. And of course, the economic injury loans were available before the PPP loans. And so the Office of Disaster Assistance is quite frankly swamped with applications. They're trying to work their way out of that. And I know many people on the call are probably probably have applications in, and they're wondering where they, what the status of those are. And I can tell you the Office of Disaster Assistance is working very hard to try to clear that backlog and get caught up. And, I'm talking to borrowers every day that they're starting to see funds come into their accounts. And many times the funds beat any correspondence. So, a business will go and check their bank account, and they'll find that SBA has deposited some funds into their account. So just be aware of that. In South Carolina, SBA has approved 274 idle loans for over $54 million. There have been over 9,000 initial advances, and those are the piece of the idle loan that does not require repayment, and that totals $43 million. And so these numbers are climbing every day. We do expect, when we get when Congress passes the bill and we receive more money, I would agree with Fred. I think it's probably going to be Friday or Monday when we give the green light to lenders to get started again. And I think, we came out initially. We came out of the gate stumbling a little bit. Both SBA and our lenders. We were on a very steep learning curve. We had some internal infrastructure issues with IT and that kind of thing that we had to beef up to handle this kind of volume, and all of that has now been done. And so the lenders that I've talked to, they're quite honestly, they're amped up and they're ramped up and they're ready to go. And I hope computer systems are in good shape to accept that kind of volume as well. So I think the funds will move a little more quickly in this second round than they did in the first. But what we can expect kind of going from here, lenders are funding and closing all of those loans that they did in the first round. So a lot of businesses are getting that capital that they need for payroll. That's going out in the community as we speak. They have 8 weeks to get that done, to use those funds, and then they'll be working with their lenders for debt forgiveness. And so, we're just, again, moving forward. Just want to thank Fred Green and all the commercial lenders. I think we work very well together, both with SBA and the commercial lenders. We've all accepted the challenge and have gotten this done. And so I feel really confident that going into the second round, it will be even more smooth, and again, that it'll be more efficient and go a little quicker, fortunately or unfortunately, depending on how you look at that. But I'll be happy to answer any questions if anybody has any.
Thank you, William. I had referenced a survey a little bit earlier in the call, and we had asked, one of the questions was if did your business apply for the payroll protection program? And of 641 respondents, 55% of those said that they did, which was roughly 352 businesses said that they have. So glad that to receive the additional funding and how important that is. Moving on to question, we have a question today from Janet, and Janet says, we're a new startup business. Because we were not in business by January 31, 2020 deadline for receiving disaster relief loan assistance, we want to know what other options do we have? What's being done for new startups? Okay, to start off with, the start date or the deadline is February 15th on that. So that could potentially open up eligibility for you. Couple of weeks there difference. So February 15 is the date that you need to look at as far as a new business goes. And, if you don't meet that, unfortunately, then you're not going to qualify for the disaster recovery loans, whether it be idle or the PPP. But SBA does have other loan programs, and those programs are intended to assist startups, and those funds can be used for working capital. They can be used for expansion. So we do have other programs. We also have micro lenders that serve that or serve the state that can help as well. And those micro lenders are
organizations that provide funds for smaller type loans, typically it's $50,000 or less, that for situations where they are not able to get, a business is not able to get financing from a commercial lender. So there are other options out there, and we'd be happy to talk to you. And that's a good place. Our resource partners, SCORE, and the Small Business Development Centers are there in the community as well, and they can help small businesses with those types of issues too.
Thank you, William. Also, another question here from Keith. Do you have to spend all the money in the 8-week program?
To be considered for loan forgiveness, yes, you do.
Okay, let's see. What about
William? Can
another?
Yeah,
go ahead.
William, can I ask maybe a follow-up question? This is Fred Green, and just for clarification. So, as an example, if someone has a $100,000 PPP loan, and that was based on the payroll at that point in time, and during that 8-week period, let's just say that that half of their employees left, so then their payroll was cut to $50,000. As I understand it, the $50,000 would be the number that would be considered convertible to the grant. Is that correct?
I think, and I will say this, kind of, in my opinion, I think that's correct, but SBA still has to provide additional guidelines to cover, that debt forgiveness. So, I think that line of thought, it would, it makes sense to me, and hopefully that's what SBA will come out and formally say. But we are, again, this was as it's been said from our leadership in Washington, this was a project that we got the plane up in the air while it was still under construction, and we're still putting parts on it and still developing the program. So to me, the forgiveness part is the landing gear, and we've still got to get the landing gear on the plane.
Okay, we have another question from Joe, and he says, we applied for the EIDL through SBA portal 2 weeks ago. We received an application number, and we're not asked for an amount of the loan we need. At what point will we be asked the amount of the EIDL we need?
Okay, that's a good question. So you will actually not be asked for the amount of the loan that you need. SBA will calculate your working capital needs for 2 months based on the information that you provided, and they will make you an offer for a loan to provide that funding for those 2 months of working capital. Now, in addition to that, you have the initial advance, and that advance is not required to be repaid, and it is based on a formula of $1,000 per employee. So if you have 2 employees, you get $2,000. There is a limit of $10,000 on that. So 10 employees would get $10,000. If you had 15 employees, you would still get $10,000.
All right, William, thank you. Another question from Kim. What about if you applied and didn't receive anything, any guidance?
You should have. It depended on when you applied. SBA went through about 3 different IT processes for that application. Initially, you may not have received anything. If you're concerned, I think the portal will reopen once we receive additional funding. And if you were really concerned about that, you could go back in and you could reapply. And if it happened to be a duplicate, the system would pick that up and it would be okay. You would not receive 2 loans. So you could do that if you're concerned.
Okay, and let's see. Okay, I think that's all the questions that we have for Fred and for William. Thank you, gentlemen, for both joining us this morning, and your answers to the questions and updates have been very, very helpful as always. So thank you for joining us.
Thank you.
Thank you. Thank you.
And lastly, today, we know that there are many organizations that are doing great things. And this morning, we're fortunate to hear from J.R. Richardson and Lee Lucier on the great things that they're doing with Operation Barbecue Relief. J.R., we'll go to you first.
Well, thank you, Bill, for the opportunity to talk about what we're doing. It's a little more local than all the bigger things you've been talking about this morning. But sometime about 3 weeks ago, we realized that we have 4 restaurants in addition to several, a lot of tenants. And so we're trying to figure out what can we do to help them out, because we did furlough of some 70 or 75 people. And I was trying to figure out how to make that work for them, because they live from day to day. And so I was talking to Lee about it, and we came up with the idea that we have the facilities that we would provide meals daily for them. And so 3 weeks ago, we started providing meals, and we've served over 10 or 12,000 meals in the last 3 weeks. And we're going to continue to do that with Barbecue Relief and Cisco as we go forward. And I think Lee's going to talk to you about the additional thing we're doing. We're going to continue it as long as we can afford to continue it. It's been a great program. We're serving in the Hilton Head location somewhere around 750 people a day, and we serve until we run out of meals, and it starts around 4 to 6. So it was just a community effort to help people in the restaurant business that don't have the opportunities that some others have. And as a result, we have more than restaurant people coming, but then that's fine too, because everyone that needs it is welcome to have it. So Lee, I'm going to turn it over to you and let you talk about the details of what you've been doing. I have to also say that this is one of Lee's ideas that we put into play, and he came up with the barbecue relief part of it, and it's just been worked out. It's worked out so great for the community.
Thank you, J.R.
Thank you, J.R.
Go ahead, Lee.
Thank you, Bill, for having us on this call, and everyone in the Low Country who's helping out leadership positions, and just everyone on the call. Thank you for the time, and thank you, J.R. and Leslie, for allowing us to do this. With the meal program J.R. is speaking about, we started April 4th, and at this point, we've served over 12,000 meals, as J.R. had said, and nationally, Operation Barbecue Relief, which is the foundation we partnered with, has served over 250,000 meals for COVID-19 relief. With COVID-19, Operation Barbecue Relief had to think differently on how to respond. Typically, they respond to disasters throughout the country, and especially in the Southeast. But they started a new program with coronavirus called Operation Restaurant Relief, which is cooking in individual restaurants, because they weren't available to go out and cook in fields and mess situations and provide for the communities. So with Operation Restaurant Relief, they went to the individual restaurants and had the restaurants prepare the meals for the community to pick up. We were very proud that Fish in Coligny was the first restaurant in the country to be partnered with this program. This week, through Operation Restaurant Relief, they've served over 220,000 meals this week alone, and by May 1st, we'll be serving over 500,000 meals a week. Another key part of this is job recreation. We were able to bring back 4 employees that, unfortunately, we had a furlough due to the virus, but bring these people back to work to provide these meals for the community. Lastly, monetary donations to help with the program is the biggest thing that can help. These continues here in Hilton Head and Low Country continue, and additionally, they can continue throughout the country. And for donations, they can visit operationbarbecuerelief.org and specify the Hilton Head so we can use these again. Lastly, yesterday we were able to expand the program to Bluffton. We started yesterday at Enclave at Bluffton Park with new apartments over in Bluffton. Fortunately, they have a parking lot area that suited our needs for pickup for all these meals, where the people that want to get the meal pull up, they tell us how many meals they need. The staff, the volunteers drop the meals off, and then the guests come out of the car, pick up the meals. So there is social distancing, and it's safe for our staff, and it's also safe for the people picking up the meals. And again, that started yesterday in Bluffton, so now we have 2 locations functioning. It's 4 o'clock every day in Coligny and 4:30 every day in the Bluffton location.
Lee, thank you. And thank you to JR as well for the great program that you all are leading. And it's making a real difference, not only on our community, but the bigger picture as well. So we appreciate that. With that, that concludes all of our speakers today. And we thank you for joining us. I saw a quote earlier in the week that said, it was from FDR, and it said, "A smooth sea never made a skilled sailor." And I think these challenging times are allowing all of us and challenging us to hone our skills a bit. So good luck, stay safe, take care of one another, and thank you for joining this morning. We'll talk to you next week.